Certainly. Well, first I want to thank you for inviting me here, and thank everyone for tuning in. This is an awesome opportunity for me to be able to speak about some of the things that I'm passionate about, especially healthcare and delivering good quality healthcare to people who may be in need.
My name is Myron, and I live and work in Boston. My wife Latoya and I just had newborns, and when I'm not with them, I try to find any way possible to connect with them. Family is everything to me. Some people know me as Myron Rolle, retired NFL safety, but now I wear a different hat. I'm a fourth-year neurosurgery resident at the Massachusetts General Hospital. At this hospital, we treat some of the world's leading cases in neurosurgery with some of the smartest medical staff in the world. I'm fortunate to be where I am, and I have my history to thank for that. My family is originally from the Caribbean.
My parents are from the Bahamas.
Ever since I was a kid, I've always been close to my Bahamian family. My auntie was the pillar in our household, always keeping everyone together. At the time, I was still in the NFL, so she would even remember all of my NFL stats. In 2012, I was at a major crossroads in my life, deciding between either staying in football or pursuing a career in my other passion, neurosurgery. While in the middle of one of the biggest decisions of my life, one day I would get a phone call that would change the course of my life forever. It was that day that Daddy called me and told me that Auntie had died. She was hit by a car in the Bahamas and had to wait 7 hours for her head trauma to even be evaluated by a neurosurgeon. By the time she was seen, it was too late, and she died in the clinic. My whole world had changed. Someone who was so close to me, and someone who I admired so much, was taken away from me instantly. We lost a pillar, a champion, our hero, and that was a really hard time for all of us. After we lost Auntie, I started doing some research. I wanted to know why she was forced to wait 7 hours to be evaluated, and I realized that Auntie's death was actually the product of a more broad systemic problem in the Caribbean. The Caribbean's geography is one of the biggest hurdles when it comes to patients getting trauma-related care. The distance between the islands and lack of centralization makes it impossible to treat all of the trauma-related cases within the recommended 4-hour window. After Auntie passed, I couldn't help but think that her death could have been prevented. I was not a medical professional. I was not a neurosurgeon, but I knew there was a solution, and I was committed to help finding it. Finding that solution started with me altering my career. In 2013, I retired from the NFL and I applied to medical school. I had only one goal in mind: to become a neurosurgeon and fix the medical disaster in my country. I applied and was accepted into Florida State University College of Medicine and got right to work. Within 4 years, I graduated medical school and matched to neurosurgery at Massachusetts General Hospital and Harvard Medical School. When I matched, I realized I had an opportunity to learn from some of the best neurosurgeons in the world. At the same time, I began traveling and meeting doctors in the Caribbean, working with them to explore ways that we can solve the issue of neurosurgical disease. I wanted to make sure that no one faced the same issue my auntie had faced. One of those people that I met was Dr. Susheel Wadhwa, one of only 2 neurosurgeons in the Bahamas.
The Caribbean is a real mixed bag. There are pockets where there is development happening at a faster pace than in another place. There are some islands where, there is literally no neurosurgeon. And then there are some islands where you have 4, 5, or maybe more. So it's kind of inequitably distributed as far as I understand it.
After meeting with Dr. Susheel, I went back to Boston and got to work. I reached out to some of the best medical professionals I knew, people with backgrounds in policy, neurosurgery, and international implementation, and asked for their help. We brainstormed and came up with a plan of attack, and together, we started the CARICOM Neurosurgical Initiative.
In a landscape like this, the CARICOM Neurosurgical Initiative is a great idea. because it's bringing in all the neurosurgical community of the 15 CARICOM countries together. That way, we can kind of look at what our strengths and weaknesses are and how we can collectively overcome them and have the CARICOM as a whole be known for neurosurgical services.
Very tied to the country and to the people, and I always feel proud to be able to represent the Bahamas and everything that I do.
These islands are more than just a vacation destination. They are home to around 16 million people who right now are served by just a handful of neurosurgeons with limited capacity. These are people that deserve equal access to healthcare. My auntie was the pillar of my household, and I know how hard it was for us when she passed away, especially knowing that there was a chance that she could have been saved. No one deserves to lose a family member because of a preventable death. I've been given so many opportunities because of football. It got me to Florida State, to Oxford, the NFL, Harvard, and finally here, solving the problems in my own backyard. So whether it's as an academic, doctor, an athlete, husband, father, or nephew, this initiative is for my country. This is for my home.
Anywhere I go, I carry with me the name Rolle and also being a Bahamian.
Very good.